A 68 years old with poorly controlled diabetes presents severe otalgia and headache. On examination, there is granulation tissue within the external auditory meatus. What is most likely underlying infective agent? That means a 68 years old man, diabetic, present with otalgia and headache. And on otoscopic examination, there was found granulation tissue in the external acoustic meatus. That means we know this is the external acoustic meatus, this is the pinna, then middle ear and inner ear. So in this area there is the granulation tissue. So what is the underlying organism? Here the options are the Pseudomonas aeruginosa, Streptococcus pyogenes, Staphylococcus aureus, Actinomycetes, Bacteroides fragilis. In a normal state, usually the organism is different, but in case of diabetics, that means immunocompromised condition, the organism is different. So first of all, let's see malignant otitis externa. That means the inflammation in the external ear, which looks like malignant, but it is totally benign condition. Let's say it is uncommon type of otitis externa, and it occurs only in case of the diabetic patient or immunocompromised patient. So malignant otitis externa, it usually occurs in case of diabetic patient, and also it is found in immunocompromised individuals. So immunocompromised individuals such as diabetes mellitus patients suffering from the chronic kidney disease and other systemic disease such as rheumatoid arthritis, systemic lupus erythematosus. So in this condition, when there is immunocompromisation occurs, that means the immunity of the person reduce. In this condition, malignant otitis externa develop. Though a name is malignant, but it is not malignant. And the infective organism, this is most important, which is the Pseudomonas aeruginosa. So Pseudomonas aeruginosa, it is the main pathogenic organism for this malignant otitis externa. Infection commences as a soft tissue in the external auditory meatus. That means this infection occurs in the external acoustic meatus, which is part of the external ear, and this involve the soft tissue, and when this continues, it can also invade the bony ear canal, and sometimes it may cause temporal osteomyelitis. If the patient left untreated or neglected, in this condition temporal bone osteomyelitis also may develop. What is the history? Malignant otitis externa, the key feature, first of all, the most important points, the patient is diabetic. About 90% of the patient are diabetic, and rest of them some other immunocompromise or immunosuppression, such as patients suffering from the chronic kidney disease, from the systemic disease such as the rheumatoid arthritis, systemic lupus erythematosus, old age, extreme of those. In this condition, the malignant otitis externa develop. Severe unrelating deep-seated otalgia. So there is severe otalgia develop in this condition. That means pain in the ear. Temporal headache sometimes develop, and purulent otorrhea also develop, and possibly dysphagia, hoarseness, and facial nerve dysfunction. But these are the late feature. Mainly the feature of the external ear such as pain and otorrhea present, but in case of advanced stage, dysphagia, hoarseness, and facial nerve paralysis may develop. What is the treatment? As it is the Pseudomonas, so give anti-pseudomonal agent. Then topical agent, hyperbaric oxygen may be useful in some cases. So what is the treatment of malignant otitis externa? It is the treatment of the organism. That means the Pseudomonas aeruginosa, it is the causative organism or responsible organism for malignant otitis externa. So treatment of the Pseudomonas, that means anti-pseudomonal agent is enough for treating this malignant otitis externa, and topical agent may be used, and also hyperbaric oxygen may be used. Malignant otitis externa caused by Pseudomonas aeruginosa, and it causes severe pain, severe ear pain, then headache, and also granulation tissue within the external auditory meatus. And the key feature of the malignant external otitis externa. That means the severe pain, granulation tissue, also headache. These are the key feature for malignant otitis externa. Diabetes mellitus is the most common cause of malignant otitis externa. So what is the underlying infective agent for this condition, which is, that means the diabetic patient granulation tissue within the external auditory meatus, otalgia, headache. So first of all, diabetic, otalgia, headache, granulation tissue in external acoustic meatus. These are the diagnostic for the malignant otitis externa, and it is caused by the Pseudomonas aeruginosa.